No. The video is okay. I think it was hang the video. So I'll replay for you. I will replay for you. Don't worry. I think it was hang.
Yes. Yes. Okay. Yes.
Okay. So you want to see again? Okay, I'll play again for you. No issues.
Mm. So, okay. Mhm.
Okay.
I can. Okay, thank you.
So
I
just
can see 11 years.
okay. Continue.
Yeah. I can see 11-year-old male lying on his bed, comfortably, not in distress, no dysmorphic. He is at hospital department or clinic, I don't know. There is no cannula in his hand. There I can see asymmetry between left and right knee. There is a swelling of knee swelling with no redness, but there's no redness, okay. And there was a positive palpable patella on examination on right side. Okay, and there is a limitation of movement at right side. Knee extension and flexion, there is a limitation of movement during flexion and extension of his flexion, actually, of his knee joint.
Okay, very good.
Okay.
So what two questions in the history you will like to ask?
I want to ask if there is hotness or limbing, if there is a history of trauma.
Very good.
Okay. Upper respiratory tract infection.
Good.
If there is acceleration of his breathing.
Okay.
And if there is a pallor, skin rash. Yes.
So what test?
Abdominal distension, if there is.
Okay, what test you would like to perform?
I want to perform, he already, the examiner, knee examination. Test, you mean lab results or?
Yes, blood test or
examination.
Investigation. Yani
blood
investigation.
Test.
Which investigation?
I need for him full blood count. I want for him CRP, ESR, blood culture if he is toxic or febrile. And I need to do for him joint ultrasound. And if there is fusion, I can guided ultrasound guided for knee aspiration to check for culture.
I didn't ask you what is your differential and what is your diagnosis.
Yes. My differential and diagnosis.
Yeah.
My my diagnosis may be my septic arthritis.
Okay.
Okay, my differential may be trauma. Maybe monoarticular. If there is no any other joint abnormality, I will check before. If it is unilateral or only monoarticular, it will differ a little bit. Monoarticular or there is any joints affected.
How you're going to treat this child?
I want to treat for him first fixation, decrease movement, not fixed, but decrease the movement for him, and to start antibiotic.
Okay.
According to cause, doctor.
Okay, so you would like to treat it according to the cause. Okay, your time also up. Okay, that's a very good try,
yes,
Dr.
PTT, I forget to ask PTT. Maybe he will be hemophilia.
Very good.
Yes.
Yeah, very good. So that is a very good try for someone who is beginner and who has not practiced too much. I don't know why you guys are so much shy. Like there were 28 people and just she said that I would like to do it. So I think that's really bad. I mean, you should be doing it. Everyone should fight for it that I'll do it. One thing, Doctora, like just 1 minute, please.
Mute.
Give me 1 minute, please.
I've got an exposure today. Should be able to read. Total awareness of stage went down, stage back, total awareness of stage went down.
Okay, I'm very sorry. Actually, I had one patient. So what I was saying that I think it was a very good try for someone who is absolutely a beginner. I will just play the video once because many people joined. So just see this video once, then we'll do discussion, okay?
This is hypothalamic maneuver, doctor. Artillery. There is a limitation. في عندنا بروز على ال
Was there any sound for this video, Doctora?
Sound, no specific sound, doctor.
Yeah, actually, the problem is whenever I'm sharing video, I don't know, there is no sound. So I will fix this problem. But anyhow, sound was not that important in this video. See, just once more, I will play it. Okay, just once more. Okay, then we will do discussion.
Not clear sound, Doctor. There's a sound, but not clear.
Okay, so
Mm.
see, one thing which is very important is that you need to see the video very, very carefully. Why? Because the video is a station in which you need to take full marks. Because
Yes.
if you take less marks in video, then the problem will be that the just kindly mute yourself, everyone who is not talking. I'm just muting you guys. I'm very sorry. Okay, whoever wants to talk, so he should just unmute. Okay. So what I'm saying that you need to see the video very, very carefully, because I just give you, whenever I give you example, I'll give you the example of the candidates, because I'm also now a teacher. So I'll just give you the example of the candidates which just gave me a feedback. So remember that the video will never be a straightforward. Okay. They choose the video in which there is some sort of ambiguity on the day of exam. Maybe some
Okay.
video will be very clear, but some videos they keep some ambiguity. Why? Because at consultant level, they want you to, because you will take a big degree after that. So they just want to judge your level, that what you do if you have a doubt in your mind. Okay. So they also check these things. So there was a case, that case, they were showing just a child, there was no sound, they were just showing the eyes, they were just showing the mouth, they were just showing everything. So it was fitting into the Kawasaki. The age was also there, but the problem was that there was no rash on the body. But honestly, there
Yes.
was generalized rash on the body, but nobody could pick it. Why? Because it was very faint. Now, that's what I want to say is that if you remove the rash, so maybe the diagnosis is totally different. And if you put the rash, so maybe the diagnosis is totally different. So that's why what I mean to say is
Yes.
that if you have a time, because you have 3 minutes, I think, or 4 minutes watching time, so keep on watching it and give full concentration to the video. Why? Because you need to take 6 out of 6 marks in every station. So there are 12 marks for the 2 video station, and you need to take 12, not 11. Why? Because a single mark will be very important on the day of exam. Okay. So here, like that was a very good pick, that there was a limitation. You I don't know what term you used, but you need to use very proper term on the day of exam, because this is not a small exam, this is not DCH, this is MRCBCH. So you need to say that
Yes.
I could see that there
Yes.
was limitation of the range of movements of the right knee joint. You need to say crystal
Yes.
clear things. Okay.
Limitation
And
of flexion movement, I said.
yes, because there is
Yes.
no uh, uh, yeah, you can say limitation of flexion movements. Okay. Then the other thing
Yes.
is that I am not sure that whether this is painful limitation or not painful. Why? Because I could not see the face of the child, and I could not, and there was no sound. A good candidate will also comment on this. Okay, because this limitation
Okay.
may be secondary to pain. The examiner may
Yes.
be looking at the child, and that is painful. The other thing, I could see that there was redness over that area. Okay. If
There
you
is no.
watch, see, I'll play that again for you, but if you, I mean, see it carefully, I could see that there was uh, some sort.
Redness.
Yeah, just check it. Compare the two. Okay.
Yes, laterally. Yes, lateral side. Okay.
Yeah, it looks like, I mean, just compare
Yes.
the two. It looks like there is faint. I mean, this one is a bit more red as compared to this one. Just look at these two. Okay.
Yes.
So there is
Yes.
some,
Yes.
and also there is some sort of this spots over this. Now you
Yes.
should comment on these spots as well. This may be that they have tried a tap. Maybe they have tried a tap, or maybe this is a trauma. area over here. Okay, so you have to comment on these, that I can see a very small tiny spots. I cannot appreciate
Yes.
that exactly, that what is that, but maybe that may be a tap which is being performed, or that may be a trauma which has been done to this child. Okay, the second thing is you did not comment on the clothes of this girl. I think she's a girl. So just see, just see and just look at.
Boys.
Oh, okay, maybe boy. Okay, just look at the clothes.
Yes.
Wait, they will show. See, these clothes, this shows that she is a sports person, or he is a sports person. Okay, so a sport person, maybe this is a
Yes.
sports injury. You did
Yes.
not comment on that, and you have to, if you want to take 6 marks, you comment on them. You comments on these things. Okay,
Yeah.
so this give you extra marks. Sometime a good examiner, if you do some mistake and if you comment on these small tiny things, so he will think, okay, I mean, she missed that thing, but I'll give her full marks. Why? Because she comment on very tiny things. Okay, so
Mhm.
you commented on things which were not there, but you did not comment on something which was there. Like you comment on IV cannula, that was not there. So why to comment on that which is not there? Because you have very little time.
There's no cannula.
Yeah, but you said that there is no cannula. So what was the point saying that? Because it was not there. So why to say about that? Say about something
Yes.
which is there, like the clothes
Yeah.
of a sportsman is there. So comment on that. Okay.
Mhm.
So this is just a teaching point. Okay. And
Mhm.
otherwise, rest of the way you did very well. One other thing that I mean, you should be doing it like as you are in exam. Okay, you should not be in a very relaxed mode. Like you are in a very relaxed mode, and it's like this, that this station was an easy one, but sometime you may come across a difficult station, and then it will be difficult. Okay, with me there
Mhm.
was a question, but I did not ask you that which test the examiner was performing with his fingers. What was the name?
Pollutable. شو اسمها pollutable sign ايش اسمها؟
Okay, anyone else?
Patellar tap, sir.
Patilla sign.
No, this
For fusion.
yeah, this you can call it patellar tap sign. Okay. But this is not patellar
Tap
tap.
sign,
Patellar
yes.
tap is something else, but patellar tap sign, yeah. That's very good. Okay. So rest of this is fine. You did very well.
Fusion.
Sorry.
Is
Yeah.
squeezing and is basically checking the fusion.
Yeah. Just to look for effusion. Yes, very
think,
good. Okay. Yeah, that's good. Okay.
Yes,
Dr.
patilla
There was also the
pollutable.
fluid in that affected area or not?
Pollutable sign for patilla.
Yes. I mean, this is actually patellar tap sign. You can say patellar tap sign. So this is, everyone knows that this is actually for fluid in the joint. Okay, good. Okay, Dr. Rehana, are you here? Dr.
Yes, I'm here, Papa.
You can perform another video?
Maybe next because I will go out of ICU by the time. You are having another or just this one?
Yes, I have next one. Okay, you want to the third one. Okay.
Okay, I will just go to the other room. Wait, I'll see. Yeah, I can
Okay.
manage to go. Okay.
Okay,
Wait,
so
that's
just
fine. Yes, you can start.
just 1 minute, okay?
Okay.
Okay, Dr. Rehana, I'm playing it now, okay? But I think the screen is not moving, right?
Okay, sure.
Okay, just wait,
It's not
just wait.
moving.
I do that again. Just wait. There is a problem.
Sure, sure.
Okay, I'm playing it right now.
It's not moving, sir.
It's okay. I'll play again.
It is, oh, no.
Okay, I'll play
No,
again.
but
I'll
it
play
is
again.
slow.
I'll play again. Okay.
Sure.
Okay, that's okay. Or you want to see it again?
It is much, it is small clip, right?
Yeah, that's one. That's it. You want to see again, or that's it?
Okay, show me one more time because it's sometimes
Okay.
stopping here. Okay. I
Okay, so
can
it is.
see a 8-year-old boy.
Mhm.
I can see a 8-year-old boy get up from the floor, which is looking difficult for him to get up. And he's like going in the with the goal sign, like touching the ground and feet, then coming up. So it's difficult for him to get up.
Okay.
While he's smiling, he's looking well.
Mhm. Okay. So,
This much I could see from the video.
okay. So, what question you would like to ask in the history?
I would like to ask about the what chronic condition he is having, and
You
and what
cannot ask.
medication he's on.
I mean, you cannot ask that what condition you are
Okay.
having. History. What you will ask in history.
What in the history? History, I will ask any recent infections
Mm-hmm.
and
Okay.
what else should I ask?
At least two questions you should be asking. Dr. Rehan, I think you did not slept well. Okay. Okay, no problem. Okay. What investigation you would like to order for this boy?
I will do I will do the EMG
Mm-hmm.
and also the maybe the imaging.
Like which
EMG,
image?
nerve conduction, and image.
Okay. Okay. So nerve conduction, EMG, and imaging. Okay. Imaging of what? Spine,
MRI,
brain, MRI brain or spine?
MRI brain and spine. Brain and spine.
Oh, okay. Okay. How you are going to manage this child?
It will be the multidisciplinary. That means the neurology and physiotherapist, occupational
Uh,
therapist,
okay.
and psychological support and social worker.
Okay. Okay. You did not tell me what is the diagnosis and differentials for this child.
Maybe this is the This myopathy is Duchenne muscular dystrophy.
Okay. And
Or
what is
could
differential?
Becker,
Okay, and differential?
Becker,
Becker. Okay, very good. Okay.
BMD and Becker.
Okay, very good. So I think your time is also up. Okay. So what test you perform for DMD and Becker? You do MRI for that? You do nerve conduction for that? Is there any role of nerve conduction in myopathy?
No.
If the examiner is bad, he will just screw you then. I mean, you said myopathy correctly, you said, okay, but then why you are saying then? Yeah, I can understand. Actually, you're on duty, you're in ICU, so I can understand because many things will be happening around you, so that's okay. But I mean, you correctly said the findings that yeah, this is actually you can see it like this. See, Dr. Rehanna, I mean, you need to be very bold, okay? On the day of exam, if you don't show boldness, I think you will lose a lot of marks. People might be teaching you the books things, but I'll not be teaching you the book things. I'll be teaching you about the way you present yourself. Why? Because what I know is that 70% of the UK exams, they are communication. And if you don't have a good communication, I don't feel that the how much good you are in knowledge, I think it will be difficult. Okay. So what you need to do is that be very bold and confident. So how you can say is that yes, I saw the video of an 11-year-old boy, and it appears that he's performing a Gower test, and I can see that this test is positive. Why? Because he is having difficulty in standing up. Then you can say that how he has difficulty because he's just holding up and he's just trying to hold his body over his knees, and which is actually a Gower test, and this is a partial Gower test. If you want to take some more marks, you can say this is a partial Gower, because complete Gower is when the child is sleeping and you ask him to stand, so he'll be sleeping on the floor. Yeah, lying down, then he will be sitting, and then he'll be standing. So this is the complete Gower, okay? That is called Gower Minor. And this one is Gower test. So, I mean, say
The investigation
confidently,
we do
do it.
actually the genetic testing.
Yeah,
Genetic testing.
because you know it, you know the subject. I'm 100% sure that you know the subject, but because the examiner doesn't know that you know the subject or not, he has not practiced with you, he doesn't know that how good Rehanna is. So what you need to do is that you have to show the things, okay? You have to show them that I'm good, and that is very much important to show them. And otherwise that was very good. Like, I mean, your diagnosis was fine, your differential diagnosis was good, but when it comes to the investigation, why? Because if you see the examiner checklist, there is clinical findings, the examiner, the student picked or not, okay, he will tick it. Then he say there is diagnosis differential, he will say yes, she picked. Then he will say clinical reasoning, he will cross that because your clinical reasoning was not good. Okay, so the clinical reasoning portion is very important, because in that portion you will take the positive findings as well as your investigation and your diagnosis. You will just, I mean, make a link between them. So that is pretty much important, that I mean, your link is okay. So clinical reasoning portion was not good. So maybe, I mean, rather surely you will get through, but I mean, you will lose the marks. Yes, iPhone. I don't know what is the name. So iPhone.
Hello, I'm Dr. Naresh, sir.
Dr. Naresh, great man. Okay.
Yeah, from India.
Yes, sir.
Sir, my question in this case is this: like, this child is basically having a smiling protruding his tongue. Hello.
Yeah. Carry on.
So it could be a hypertrophy of a tongue, or just actually he's just smiling and taking out a tongue.
Okay, so what we can do, Dr. Naresh, that we should rejoin because the time is up, so I cannot answer properly.
Okay.
But it will take some time to rejoin. Why? Because this recording will be done. So 5 minutes it will take. So rejoin after 5 minutes. Okay.
Okay. Thank you, sir.
Same link.